name of our product is COVID Care. We aim to develop an AI-powered digital hospital and coronavirus laboratory. Firstly, we will start by introducing ourselves. As I mentioned, it is two of us in the team. I was responsible for marketing and development of the front end and a portion of the back end, while Deepesh is responsible for building of what he did the majority of the AI development, and he is also responsible for the majority of the back end. The both of us are students of Maharaja Agrasen Institute of Technology. Both of us are fourth year undergrad students, and we reside in New Delhi. We hope to get some like the judges to play the role of investors. And okay, now moving forward. So the problem our product is that the problem that we are trying to address is that there are millions of COVID-19 tests that have to be performed daily. Now we are seeing how the coronavirus pandemic has been on the rise. There have been millions of deaths in the United States, and our country has experienced millions of deaths, and we haven't even hit the peak yet. So the question that we are trying to answer here is that with millions of coronavirus tests that have to be performed, the same number of test kits aren't available. So how do we determine? So this makes it important that the test kits that are already present, they are used in the most efficient manner. So the question that we are trying to answer is, how do we determine which people should be tested first? The probability.
Your screen is frozen and we cannot hear you, Krittin, your audio. Deepesh, can you say something here, because we cannot hear you?
Hello, can you hear me?
Yeah, please run the presentation.
Yeah. Okay. Screen?
Yeah.
Okay. Yeah. Yeah. So our product is an AI-powered coronavirus laboratory in digital hospital, that is COVID Care. So we are two people in the team, that is Krittin, Kalra, and me, Garg.
Deepesh,
so
can I just say that we already talked about it. I think you may want to move on to the main your solution right now, because you are losing your 7 minutes. We already talked about this.
Okay, I'm moving to it. So the problem is that there are millions of tests to be performed. They have to millions of tests performed daily, but the same number of kits and doctors are not available. So hospitals are overburdened and medical workers are burnt out. So the solution is that we perform an automatic AI-based diagnosis. So that will help in determining that who should be tested first. So for example, if we have 1 million people who want to be tested daily, but the testing kits are only 500,000. So who should get the tested first? So our AI-based test, it helps in determining that who should be tested first and determines the probability. So let's start with our product. I have to turn off the camera because the product will use the camera.
Just to let you know, this is something your YouTube will not, Zoom will not allow the video audio. So you may want to explain what's going on. We can see the video, but we cannot hear. So can you just explain what's going on?
Yes, I'll go explaining.
Yeah, it's good now.
Right. So this is the start of the test, and the patient is right now filling out the details.
Have you been spending crowded place the last few days. Have you had any travel history or contact with anyone with confirmed COVID-19 in the last 14 days? Please select the symptoms you are facing. Please talk into the microphone. How are you feeling right now? Your coronavirus diagnosis is finished. Thank you for your patience. I am preparing your diagnosis. Your probability of having affected by coronavirus is 74%.
Right. Okay. So as you guys saw, in the test, we generated an AI-powered report right in the end. That I hope you guys can hear me. Hello. Sanjeev, can you confirm if you're able to hear me?
Hello, Deepesh. I have generated your prescription for recent consultation.
Right. So what we have, there are two things that we have in our product. Firstly, we have got the AI-powered test that we saw, and the latest thing that we showcased was the AI-powered doctor consultation. So the aim of this is to ensure that the doctor suggests that there is no foul play when the doctor is giving consultation to the patient, and we want to ensure safe practices. And also the AI-powered diagnosis report will automatically and we are using natural language processing for this. It will automatically extract the names of the medicines that the doctor mentioned during the consultation, and it will put those in the form of an AI report. And then this is a nutritionist chart. This is useful for these are customized charts based on the particulars which the candidate entered at the time of at the beginning of the test. And then we have this mental relaxation. So all of us have been suffering with the people have been suffering with mental health issues because they have been there. And this exercise, it is anyone can. This is to exercise using which they can relax themselves mentally. There are soothing sounds which we are using to and now this lab section here can a mental diagnostic test. They can take the AI-based digital test again. And Deepesh, can you please move forward to pathology tests? Yes, and from here, the person can find out the reports that of the test of the AI-based test, and then we also have got a digital nurse, which can be used to book appointments, lab tests.
I want to book a doctor appointment.
Yes,
I want to book a doctor appointment.
Okay.
So guys, I hate to interrupt you here, but I think your time is up, and totally very good presentation, but you may want to wrap up this presentation. Yeah, is it okay?
Just just have to wrap for Deepesh or share or if I can share my screen and
Yeah, because see, there is a lot of issue on your audio, so I'll give you 30 more seconds, okay?
thank you. Okay, so the problem that, as I was telling you, we are trying to address is we are helping doctors prioritize those patients who should be given, who should use the AI powered. With the help of the AI powered test, we are trying to prioritize.
Yeah, I think Deepesh, we lost him. We cannot hear him. Okay, judges, let me ask a question. Do you understand this the big idea here?
Hello, can you hear me?
Yeah. So I would like you guys to start your questions, judges, please. Go ahead.
Yeah, no, this is a really awesome demo. I think like it's more than a prototype. Thank you for putting it together. And also it's interesting that like the actual URL is already live. So I'm gonna try it out later.
Okay. Any questions, judges? Joanne? Kamina?
I sent in my question. I can reread it. Could your product compromise a user's privacy? I liked that the URL was live as well. And what happens if someone's data gets leaked, hacked, or lost? Do you have a plan in place for these contingencies?
Sure. So look, now we are using on-device machine learning. So that means that if when we are using the facial recognition and computer vision, and we are using the face of the person, and then we are using their audio. These are only the two privacy-related features that we are using in the test. Now, for the facial recognition, none of the not and none of the data is being transmitted to the server. It's all of the detection is being done on the device itself. So nothing is transferred to the server. And the same goes for the microphone. We are not storing any privacy related data on our servers. And this is mentioned in our privacy policy and terms and conditions. We are the only data that we collect is encrypted once the test runs on the device itself. And after the test is after the test is finished, we just collect some data points which can be used by the AI which we can use for training the AI further later on.